Hello, this is Dr. Bouvier with the Health Center of Michigan, and you've been sent to this video to understand a little bit more about low glycemic index diet. Let me say that again, it's real important. Low glycemic index diet. So what is that for? It's for diabetics and for people who have prediabetes. People ask me what our main function here at the office is, and really for any primary care doctor out there. Number one is keep people out of the hospital and emergency department, and number two, delay the onset of stroke and heart attack. Stroke and heart attack come from three things and three things only: blood sugar out of control, blood pressure out of control, and cholesterol out of control. So if you can get those things in control, you can delay the onset of stroke and heart attack for many, many years. There are other risk factors that can lead to that, like smoking, etc., but those are three main things. So today we're talking about low glycemic index. So what's a low glycemic index diet? Basically we're talking about carbohydrate. Of the three main types of food, protein, fat, and carbohydrate, low glycemic index really refers to the carbohydrate portion of your diet, which really plays a major role in your blood sugar control. Carbohydrates are good for diabetics, so remember that, and good for all of us to take, but it should be the good kind. So what's the difference between a low glycemic index carbohydrate and a high glycemic index carbohydrate? Well, if you can compare, take potatoes, white potato and sweet potato. Sweet potato is low glycemic index, meaning that it's metabolized slowly, that the carbohydrate is metabolized slowly. What does that mean? It means that the insulin level comes up nice and then goes back down. It doesn't spike. And it's that spike that really causes horrendous microvascular changes and worsens the potential for diabetes. So what's high glycemic index? Well, white potato would be a high glycemic index food. It's metabolized quickly. It spikes the insulin, spikes the blood sugar, and it's probably something that you want to stay away from. So that's just an example of a low glycemic compared to a high glycemic. Again, low glycemic index foods are carbohydrates that are metabolized slowly, usually due to the fiber content. And fiber is good for us for numerous other reasons. So this is, again, we talked about low glycemic index foods. Quick note on diabetic training. That's another reason why you're looking at this video. Make sure you use your journals in diabetic training. It's really important. Usually that 7th tab in your personal health record, this PHR. Some of you use the flash drives, but it's real important that we journal what you're eating, and it's important that you understand the difference between low glycemic index and high glycemic index. Again, this is Dr. Robert Bouvier with the Health Center of Michigan. Have a great day.